I came to Massachusetts General Hospital because my main goal is to become the most clinically excellent interventional radiologist I could possibly be. I knew by coming here I'd get to learn from some of the greatest interventional radiologists in the world. My name is Mari Tanaka. I am a third-year radiology resident, or PGY4, in the Integrated IR and DR residency here at Massachusetts General Hospital. One of the things that I really like about Massachusetts General IR is the complexity and diversity of cases that we're able to participate and be a part of. For example, since we're a tertiary referral center, we see some of the most complex cases, and I think that's great for training because you want to be able to do the most difficult cases, so when you go into practice, wherever that is, that you feel adequately prepared.
Hi everyone, my name's Avik. I'm an R2, which means that I'm a PGY3 in the IRDR program at MGH. I really came to MGH for the people, the clinical care, and the research.
I'm Rory Cochran. I'm one of the IRDR residents here at MGH. So I consider MGH one of the best, if not the best, IRDR residency programs in the country.
My name is Tommy and I am one of the IRDR residents here at MGH. One of the main reasons I chose MGH was for the attendings. We have attendings here that are leaders in their field, both clinically and in research.
Hello, my name is John DeCampo. I'm one of the PGY2 Interventional Radiology residents. I think the three main things that I was really looking for in my residency search: good case diversity and complexity, ample research and innovation opportunities, and of course I think the most important, really fitting in with the program.
In IR, they've done this fantastic job of essentially giving you everything, and you get the best of the diagnostic radiology program. And MGH has had a long history of having this concept of a full mini fellowship. So with having both of those together meant that there was actually really little change in the way MGH trained. It was the same amount of time and I wasn't cutting anything by doing the joint program.
Everything about the IRDR residency here starts with the intern year, which we do with the MGH surgery department. During that year, you get the chance to scrub hundreds of surgeries and get a lot of great exposure to pre- and post-procedural care, and all of those skills serve you incredibly well as you progress through your diagnostic and interventional training.
In years 2 through 4, we have the opportunity to work with some of the best diagnostic radiologists in the country. And then finally, during our last 2 years in training, we do interventional work, predominantly focused years that are essential to be able to get the diagnostic and interventional training that you need to succeed.
We work side by side with our attendings, and this allows us to gain the necessary skills in the procedures and allow attendings to gain trust in us as we perform procedures with them day after day.
I've been very fortunate to have really great mentors within the MGHIR department.
I met many of the interventional radiology attendings during my intern year in surgery, which has been amazing. And moving forward into my diagnostic years and eventually into my interventional years, it's actually a pretty extraordinary experience to be able to have that longitudinal learning experience where I'm able to work alongside of attendings, and as I move towards more experience, I get that autonomy and I get more independence in all the work we do.
We really have a great culture of wellness here in the Interventional Radiology Department that spans from the surgical intern year all the way through the interventional radiology years. Here at MGH, you're going to have the opportunity to find amazing mentors among the faculty.
When I interviewed here, the faculty with the program were fantastic at not just thinking about me and like my training and how to make that everything work, but also my family. And so it was fantastic to see them going that extra mile and making sure that as residents, one of the portions of wellness is family.
We found Boston was a really great city to move to because there's so many different programs in the area. It really gives people that are either couples matching in the same year or matching across years, gives them ample opportunity to both find a residency program that they would enjoy and thrive in.
Boston is full of opportunities for people interested in academics. We have some of the best universities in the world. Additionally, if you're interested in technology, there are many startups here, and it's just a great finance hub, law hub, and I think it's a great opportunity for couples to come because even if you're not in medicine, there are many opportunities for partners who are in non-medical fields.
I came from the West Coast, I came from California. Boston is a very family-friendly place. I have a 6-year-old, and there are ample opportunities to be able to get outside, enjoy not only one season as we do in Southern California, but all 4 seasons, play in the snow with my daughter, and the rich history and culture that Boston has to provide.
I've definitely enjoyed a lot of the different things that the city has to offer. It has amazing food and really, really fun and diverse neighborhoods, anywhere from Fenway Park, and if you're a big baseball fan obviously, to Back Bay, to the Seaport, to the North End, which is one of my personal favorites, That's our little Italy. There's so many different places you can go from Boston. You can go up north, up to Maine and Vermont, New Hampshire, and do great hiking, great waterfront things up there as well.
The last thing that really drew me to Boston, to MGH, was the research. I did a MD PhD, my PhD was in biomedical engineering, so I was really interested in devices, entrepreneurship, for which Boston is, in many ways, sort of a medical mecca.
We have many medical students and residents that are involved here in research. We also have the MESH incubator, which is a phenomenal opportunity for people that are interested in innovations and learning about how to bring something to market. As an interventional radiologist, working with technology so much, that's something that's really important, and I think something that we're very well poised to do.
I get to work with some of the most dedicated and smartest people I know, and that's always been super inspirational.
All the residents really just get along with each other. We hang out on the weekends, we've gone bowling, we've gone apple picking, and a lot of my best friends in Boston have ended up being my co-residents.
You definitely have that moment on your interview day where you just kind of realize, oh, this is kind of the place for me. And that was definitely the experience I had here at MGH. Everyone was so nice and welcoming. Everyone from the attendings to the residents, even the medical students that were on rotation, were just really happy.
We're like one big family at MGH. There's so many different people from so many different backgrounds, coupled with the fact that we all do so many things together and the interactions we have. It's an extraordinary experience.
From the IR procedures themselves, as you'll find out when you get here, there are certain things that only MGH does, and that there's only certain things that go that extra mile.
I come in every day and I know that I'm gonna see something different. I'm gonna have the opportunity to learn something new. Every day I'm gonna grow a little bit, and that's something that's super important to me, and it's gonna help me achieve my goal of becoming the best interventional radiologist I could possibly be.